So as Marcus said, we are a Swedish investment company. We are focused on partnering with entrepreneurs like Ali to try and build category-defining businesses. We have about $9 billion under management, so quite a large base, and that is permanent capital. We're listed in Stockholm, and so that allows us to accompany these companies along their long voyages to being big businesses. We've been lucky enough to be associated with some very large companies that have been built in Europe, in the US, and in Asia over the last 30, 40 years, including Zalando, Tele2, Millicom, MTG, GFG, Betterment. We took a decision a couple of years ago to really focus on healthcare as one of our key areas, and we did so because we saw enormous opportunity for digital to disrupt existing systems. And around that time, we had the opportunity to meet Ali, and we were looking for businesses that really could be transformational. And we'd seen telemedicine in its early stages in the US develop. We felt that just wasn't a big enough shift in terms of technology, and we felt like AI could be an interesting area to apply to primary care to improve outcomes. So we were lucky enough to meet Ali, and then we've been a partner with him over that period of time. And Ali won't say it himself, but I think he's raised more capital in the European consumer health space than any other venture business, and has really, over the last 2 years, built an extraordinary business. Anyway, I'll let Ali introduce himself and the vision and mission of Babylon.
So I'm Ali Parsa, the founder of Babylon. And you want me to tell everyone a little bit about what we do in Babylon?
Absolutely. Yeah, that's what they're here for.
I guess it says up there, putting accessible. We created Babylon to see how can you make healthcare accessible, affordable, put it in the hands of every human being on earth? Can you do with healthcare what Google did with information? And if you think about accessible, it's almost easy. As long as I can deliver most of the healthcare most people need on the devices most of them already have, that's highly accessible. The problem is there is no accessibility without affordability. How do you make healthcare affordable? And if you analyze the costs in healthcare, they sit in two fundamental buckets. One is people. 2/3 of all the money, for instance, we spend in NHS goes into salaries. Two is timing. Most diseases, by the time they manifest their symptoms, a $10 problem has become a $100, $1,000 solution. So what we do in Babylon is create a significant amount of deep technologies to be able to displace, if you want, much of what doctors and nurses do on one hand, and then to be able to simulate, to predict the future health of our users on the other hand.
Great. And so for the audience, that's treating conditions that exist today, but more importantly, to solve the bigger problems, is also preventative care over the long term. Ali, do you want to sort of give the audience a sense of, if you take numbers, if you take, let's say, 1,000 people in the traditional doctor model, they would have to seek appointments in a GP, they'd obviously wait for those appointments, they would have to then see the GP, there's a risk of quality care difference between different GPs, et cetera, et cetera. How would you, what are the dynamics of your business, and why does it make that a whole lot easier if you take that 1,000-person example?
So if you come in to Babylon today, say 1,000 of our users would come in, and the app will very simply says, hey, how can I help you today? And you just come in and you put in your symptoms, you have a conversation with a chatbot, which sits on what is, I understand today, the world's largest probabilistic graphical model, sitting on the largest knowledge base in medicine, 530 million streams of knowledge. And it kind of has a conversation, it can take a few minutes, and it turns back to you today, and it tells you whether you need to see a doctor or not. In December, we will launch a product that actually will tell you exactly what's your disease. So what we find is that 40% of our patients actually don't come and see a doctor, and we've actually launched that in what is the largest deployment of artificial intelligence in medicine in the world, I understand, with National Health Service in Britain, just north of here in London, for 1.5 million people. And what we've seen again is the same results. 40% of those who use it just don't carry on. They get satisfied, they're short, move on. Of those who come to us, when we then do the diagnosis, and we give them the diagnosis, more importantly, we give our doctors the diagnosis, what we are finding in tests is that our doctors can now diagnose you in 40 to 50% less time. And because the machine is listening to the conversation, the natural language processing is writing the notes for the doctors. So the doctors, the 10% of the time they spend writing notes, disappear. So your 40% don't show up on you, 40 to 50% you take less time consulting them, and then you save 10 to 15% of writing notes, you're 75% cheaper in the provision of diagnostics, consultation. And I think in any business, when you have a 70% cost advantage, you have a significant cost advantage.
And as you thought about this business, I mean, again, for the audience in the UK, the NHS is the largest single payer in the whole world, so it's opportune that Babylon is based in the UK. It's about 98% of the UK health expenditure, so clearly this is a very scalable opportunity in the UK. But how have you thought about beyond the UK? Clearly, there's lots of different countries that could benefit from them, but I understand the regulatory environment may also be different. How's your thinking?
So we started in the UK, said, can we deliver a healthcare that people in this country would love? This is one of the richest countries in the world where our national health service is not a health service, it's a religion. We just adore our NHS. So can you deliver a service that people in here would use? And I think that we've done a great job on that, and next week we'll share some more news on the expansion of that work. The second piece will become on, okay, then we went to one of the poorest countries in the world, Rwanda, and say, can we not deliver that very same quality of healthcare at the prices that some of the poorest nations in the world can afford? And we saw an incredible take-up in Rwanda. We signed up 10% of the population of Rwanda in 6 months, as you know. And it actually did so well that we had challenges with how do you finance it. It broke every projections we had. And again, thankfully, we'll make an announcement in 2 weeks' time where somebody has now picked up, we now have found out a phenomenal financing solution. Because what we managed to do is reduce the cost of consultation to a mere pound a consultation. Imagine that, right? That you can now consult with a doctor for a single pound or a single dollar, depending on local currency. And even in Rwanda, that costs $4 or $5 to do a consultation, fully costed. So the saving for government and for donors are substantial.
And is it that the more patients you have, the more information you have, the better your systems become, the easier it is to diagnose, and therefore, whether somebody's in Rwanda or somebody's in the UK or another geography, all this data is effectively helping you improve your engine for understanding people's conditions?
Absolutely. So the system have a deep learning element to it, that every consultation you do, it learns from it. It also has a simulation capability where we are now simulating quite a lot of what we do without needing to do consultation. But having said that, you must remember, when we send a doctor to go to school, they learn, they pass an exam, at which stage we say, hey, you're good enough to be a doctor. Everything from there is incremental. And the product that we will launch in December, if you wish, figuratively speaking, has passed that exam, is good enough to be unleashed, to do a diagnosis. Everything from there onwards is just becoming incrementally better.
And how do you see, fintech, health tech, these are sectors where regulators, have historically struggled to keep up with the innovation that technology can deliver. How do you see the regulatory environment changing such that, consumers of their own choice can go out and take advantage of products like yourselves?
I think regulators are doing a great job in trying to keep up. The truth of the matter is it's very difficult for them. So often they get the very old type to come and regulate the new with the old knowledge, but that is an ongoing game, Chris. The truth of the matter is regulators will never be able to move as fast, but they're also doing their best. So it's a bit of a fun and game with regulators everywhere for us.
Absolutely. Well, thank you, Ali. Thank you for the audience for listening. Do watch out for announcements from Babylon, and for those based in the UK, you should be able to access via the NHS the product if you live in London very, very soon.
Thank you.
Thank you so much.